Hello and welcome to my YouTube channel, Dr. Winnie the Pharmacist. My name is Dr. Winnie. If you just see my pretty face for the first time, you're welcome to my YouTube channel, Dr. Winnie the Pharmacist, where I discuss all things health. So today, without wasting much time, I'm going to be discussing the topic low blood pressure. Most times, we usually look at the high parameters like high blood sugar, that is diabetes, high blood pressure, that is hypertension, and then we often tend to neglect the low parameters like low blood sugar and low blood pressure, which is hypotension. That's a topic I'm discussing today. And unfortunately, the low parameters as to the low blood pressure and low blood sugar are very, very fast killers. In fact, they kill a lot faster than the high parameters itself. So let's dive into the main topic of the day without wasting much time. Now, I'll be using three words interchangeably and they all mean the same thing. The three words I'll be using interchangeably today are low blood pressure, low BP, and hypotension. All three words mean the same thing. So the medical term for low blood pressure is hypotension. Now, what is low blood pressure? Low blood pressure or hypotension occurs when blood pressure is much lower than normal. Low blood pressure can occur as a result of a condition or as a result of a wide range of conditions. It may cause symptoms or may not cause symptoms, but if it does cause symptoms, then one may need medical attention. When low blood pressure occurs, it automatically means that the heart, brain, and other parts of the body are not getting enough blood supply. Now, blood flow to the brain, the heart, and other parts of the body is very, very important because the blood supplies or transports nutrients and oxygen to these parts of the body. So when the blood supply is low, it means that these parts of the body become starved of oxygen and nutrients, and that is the reason why they eventually develop organ injury, and ultimately this condition can lead to death and malfunctioning of these organs. The heart, the brain, and the liver are the organs that consume or require the most oxygen in the body. As a matter of fact, the heart consumes 11.6% of oxygen, while the brain consumes or requires 18.4% of oxygen, and the liver requires or consumes more of oxygen, which is about 20.4% of oxygen. And where does the oxygen come from? Blood flow, of course. So you can now see what happens when there is low blood pressure, which leads to low blood supply and ultimately low oxygen supply to these organs. And when there is low oxygen and low nutrient supply, this could lead to organ or tissue injury, which could ultimately lead to the organ or tissue death, and by virtue of the fact too, ultimately the death of the person who has low blood pressure. In fact, ischemia or low blood supply to the brain can cause brain damage within 4 minutes of lack of oxygen. Ischemia or low blood flow to the brain could lead to malfunctioning of the brain tissue, and one of the parts of the brain stops working, and then ultimately the brain begins to shut down and it dies. This leads to brain death. When we have brain death, we have brain inactivity. You can now see what comes along with low blood supply or ischemia to the brain. When a part of the brain stops working as a result of low oxygen supply or ischemia, that is low blood supply to the brain, symptoms of stroke can occur. That means the person can develop stroke. During a stroke, there is a core area where the blood is almost cut off, and the brain cells can die within 5 minutes. When there is brain death, there is brain inactivity. That's a quick one. Do you know that brain damage begins just after 4 minutes without oxygen supply to the brain? Severe oxygen deprivation can cause serious life-threatening problems such as comas and seizures. Good news is that low BP or hypotension is treatable and preventable. So before we delve further into this topic, let's look at what the normal blood pressures should be. Now, there are different blood pressures for different ages and sexes or the gender. We'll be looking at from age 18 to 39 years. The normal blood pressure for women should be 110/68. That's the systolic, that's the higher pressure, should be about 110, and the diastolic pressure should be 68. So we have 110/68. That's for women under the age of 18 to 39 years. We say that's the normal pressure. Then for men under the same age, the normal blood pressure should be 119/70 millimeters of mercury. So if you have these blood ranges are just called for these ages, for this gender, you can safely say that their blood pressure is normal. Then for age 40 to 59, the normal blood pressure for women should be 122/74, and for that of men under the same age 40 to 59, the normal blood pressure range should be about 124/74 millimeters of mercury. Then for 60 years plus or 60 years and above, the normal blood pressure for women should be about 139/68 millimeter of mercury, while that of men under the same age, that's 60 years and above or 60 years plus, should be about 133/69 millimeters of mercury. Normal blood pressure varies with age. Normal blood pressure, from what I've just said and from what you can see, it varies with age, and that's due to a number of factors which we are not going to be looking at in this video. Okay, one will normally say that normal blood pressure is above 90/60 millimeters of mercury, up to 120/80 millimeters of mercury. When blood pressure is below 90/60 millimeters of mercury, then we have low blood pressure. Did you get it? Low blood pressure occurs when the blood pressure is below 90/60 millimeters of mercury. That's when the blood pressure is below 90 millimeters of mercury for the systolic pressure, and below 60 millimeters of mercury for the diastolic pressure. Low blood pressure usually presents without symptoms, although it could also present with symptoms. But since low blood pressure sometimes presents without symptoms, it's usually difficult to know how many people low blood pressure affects. Low blood pressure can affect people of any age or race or sex. So let's look at the symptoms of low blood pressure. Maybe I should list them. 1, distorted vision or blurry vision. 2, confusion. 3, dizziness. 4, nausea and vomiting. 5, fainting, syncope or passing out. They all mean the same thing. 6, sleepiness. 7, agitation. 9, trouble concentrating. 10, upset stomach. 11, fast and shallow breathing. 12, weakness, fatigue, feeling tired, sluggishness, being lethargic. All of them are the same thing. Now, if you have these 5 pointers, these are the pointers that show that one has low blood pressure. I'm going to list like 5. when your kneecaps are cool and when you have low cardiac output, that means the part is pumping less blood than normal. And when you have low urine input, that means you're making or passing out less urine or very small urine quantity of urine than normal. When your skin color looks lighter than it usually does, that's a pointer to low blood pressure. And when the heart rate is too slow or too fast. So I've listed 5 now. Common causes of low blood pressure could be due to causes that are not due to underlying diseases or illnesses, such as 1, a family history of low blood pressure, 2, medication side effect. Other causes of low blood pressure are orthostatic hypotension. This happens when one stands up too quickly. So you should avoid standing up too quickly. When you stand up too quickly and the body cannot compensate with more blood flow to the brain, this could cause low blood pressure. Then CNS, that is the central nervous system disorders like Parkinson's disease. Parkinson's disease actually affects how the nervous system controls blood pressure. Fifth cause of low blood pressure is low blood volume. Low blood volume could be as a result of severe blood loss due to severe injuries like accidents and the likes. Dehydration also leads to low blood volume. The sixth cause of low blood volume is extreme temperatures, that's being too hot or when one is too cold. This could cause low blood pressure. The seventh cause of low blood pressure, life-threatening conditions like arrhythmias, pulmonary embolism. What do I mean by pulmonary embolism? Pulmonary embolism occurs when there's a blood clot or embolism at all. While we are talking about pulmonary here, pulmonary embolism now, and relating embolism to pulmonary, is that pulmonary, or another word for pulmonary, is lungs. That's why I'm talking about pulmonary embolism. But I want you to know that embolism is when we have a blood clot in the artery which prevents blood flow from one part of the organ to the other. In this case, if I'm saying pulmonary embolism, it means that there's a blood clot in the artery inside a part of the lung, preventing the normal blood flow from one part of the lungs to the other. Also, heart attacks and collapsed lungs, life-threatening allergic reactions like anaphylaxis, sepsis, that is immune reaction to an infection, can also cause low blood pressure. Pregnancy. Orthostatic hypotension is possible in the first and second trimesters of pregnancies. Bleeding, other complications of pregnancy, can also cause low blood pressure. So I'd advise the husbands to look out for their pregnant wives. Alcohol or recreational drugs, certain herbal supplements and vitamins, or home remedies could also cause low blood pressure. Advanced heart failure, where we have weak heart muscle, is another cause of low blood pressure. Heart and lung conditions. Low blood pressure could occur if one's heart beats too quickly or too slowly, or if one's lungs aren't working as they should. The 12th cause of low blood pressure is prescription medications. Low blood pressure can happen with drugs used to treat hypertension, neurological disorders, erectile dysfunction, like what's that drug? We have drugs that treat erectile dysfunction like sildenafil and the likes. Drugs that also treat depression could cause low blood pressure, and much more. If you experience low blood pressure as a result of prescription medications, please contact or consult with your healthcare provider. And please always tell your healthcare provider everything that you are taking at the moment, including herbs, home remedies, vitamins, alcohol, and the like, so that you can get the maximum help that is available from your healthcare provider, because they're not magicians, so they need to be well aware of what you're ingesting or what you're taking in as they are clocking you and they are relating with you, so that they could help you out. Low blood pressure actually causes dizziness or fainting because the brain is not receiving enough blood supply. So let's look at the complications of low blood pressure. I'm looking at 3 major complications. Number 1, we have falls and related injuries. Falls, these are the biggest risk of low blood pressure. Why do I say so? I'm saying so because falls can lead to broken bones and concussions. When I say concussions, I mean mild traumatic brain injury due to bombs, jolts, violent jolts or blows to one health as a result of the falls, and even life-threatening injuries, So that's one of the complications of low blood pressure. The second complication of low blood pressure I'll be looking at is shock. Because low blood pressure leads to low supply of blood to the organs. The organs now will begin to lack oxygen and nutrients. Therefore, they begin to shut down. Remember what I was telling you when I was talking about the brain and how it gets damaged, injured, shuts down, and then dead. Also, that's brain death and brain inactivity. Like I said, shock. Low blood pressure affects one's organs by reducing the oxygen supply, because the blood supply also has been reduced to the various organs and tissues in the body, and the body begins to shut down because of this limited blood flow and blood supply. So we have shock. And the third complication is heart problems or stroke. Low blood pressure causes the heart to try and compensate by pumping harder and faster, because the heart wants to supply more blood. It notices that the blood supply or the blood that it is supplying to the other parts of the body is not enough, so it begins to pump harder and faster. Over time, this causes permanent heart damage, stroke, and even heart failure. So how do we detect low blood pressure? Very simple. We should take or check our blood pressure readings regularly so that we can detect whether the blood pressure is normal or is high or is low. That's just it. How can we reverse low blood pressure? There are over 10 things that we can do to reverse low blood pressure. We'll be looking at them one after the other. We can increase our fluid intake or our water intake, so we should drink more water or more fluids. Then we should also increase our salt intake. That's one of the major things that we should do. Sometimes we'll put salt into water or make a salt solution and take salt. Remember that salt increases or causes high blood pressure. We could also make a fist like this, or clench our buttocks and cross our legs, not our hands, our legs, like this, crossing the legs. So the fourth way to reverse blood pressure is to increase the blood volume through IV fluids. You can see your healthcare provider about this. And number 5, avoid standing up too quickly. Eat smaller meals. That should be the 6th one now. Eat smaller meals with fewer carbohydrates. By implication, I'm saying we should reduce our carbohydrate intake if we want to increase our blood pressure levels. Then we should drink less or no alcohol at all. In fact, there is a lot of advantage in not drinking alcohol than drinking it. You've heard it from the horse's mouth today. Drink less alcohol or even no alcohol at all. This helps you to reverse low blood pressure. Then take folate drugs or blood tonics. Also eat foods rich in folate or folic acid like broccoli, and the cruciferous vegetables. When I say cruciferous vegetables, I'm talking about vegetables in the family of cabbage. So broccoli, cabbage, cauliflower, they are all good, and the likes. The ninth way to reverse low blood pressure is to always have a seat, especially when one feels dizzy or lightheaded. Then the 10th way of reversing low blood pressure is by wearing compression stockings. Compression stockings put little pressure on the feet, which raises the blood pressure levels up. Some drinks and foods can also reverse low blood pressure and increase one's blood pressure. So if one has low blood pressure, we should be looking at taking these foods and drinks. They include caffeinated coffee. That's number 1. Number 2, beetroot juice. Number 3, citrus juice. All citrus juices like grape juice, orange juice, lime, lemon. These are all citrus juices. They have the tendency to increase the blood pressure and, in other words, reverse the low blood pressure. We have pomegranate juice. Pomegranate is not very common in Africa here. Then we also have tomato juice. All these can reverse low blood pressure and increase the blood pressure. Foods like asparagus, like I mentioned earlier, also broccoli, cauliflower, cabbage, beans, lentils, avocado, pear can also increase the blood pressure and reverse low blood pressure. Green tea and black tea is also good for reversing low blood pressure. We also have eggs. Eggs can reverse low blood pressure and increase the blood pressure. Brussels, sprouts, bananas, these are all very good foods that will help one to lower blood pressure. Okra, the common okra that what you underrate, can help reverse low blood pressure. Pawpaw also is also good. Sunflower seeds is also good for reversing low blood pressure. Cantaloupe, peas, these are all foods that are good for reversing low blood pressure. That said, this will bring us to the end of our video. But before I wrap up this video, you know, I'm an African. In this part of the world, most times when people are suffering from ailments or people pass on because of lack of knowledge, because from everything I have said from the beginning of this video to the end, you can see that low blood pressure is a matter of concern and should be treated and avoided as much as possible. And sometimes you can see that it does not necessarily come up or present with symptoms. So someone may have low blood pressure and may not know, and we can now see the many complications that come with low blood pressure and the implications of having low blood pressure in the body. And this is actually what causes or ultimately leads to death. Sometimes you just have sudden deaths and people don't know. They didn't know that this was even happening to them. And you just see somebody fall down or something happens or someone develops stroke. It's not all stroke that one develops or hypertension that is due to sedentary lifestyle or the usual regular causes that you know. You heard all the ailments and the complications that I mentioned in this video. I'm sorry that this video was long, but I know that it was very informative also. Some of these things could happen to someone here in Africa, because then Africans, they believe so much in my village people do me, this person has done me, that person has done me, or something happens and then somebody starts praying. I'm not saying it's not good to pray, it's very good to pray, but it's also good to match prayers with actions and then try and find out what exactly is wrong with you. And then you can now see that routine blood pressure checkups are also good. A routine visits to your healthcare provider is very necessary. Please, with these few points of mine and with this video, I hope that we have learned one or two things today about low blood pressure and about our health. And please, I'll encourage you to share share this video as much as possible. Like, comments, put down your comments or questions in the comment section, and subscribe, please. Help to liberate the world, because as you're sharing this video, you're helping someone who does not have an idea of what is happening to become aware. You're helping to liberate the world. You're contributing your own quota to helping humanity. Please don't also forget to hit the notification bell so that you can be notified anytime I drop new videos. That said, I'll be signing out. Thank you for watching. God bless you.